Hi, my name is Alfred Johnson. I work for the Wisconsin Department of Health Services. I specifically work within the Division of Quality Assurance as the Deputy Division Administrator. I've been here within the state of Wisconsin for 23, will be 24 years at the beginning of next year. Really enjoyed working for the Department of Health Services. Our mission, specifically within the state survey agency, is to protect individuals, to promote quality of care and quality of life for the individuals that live or participate in the services that we regulate here in the state of Wisconsin. One organizational best practice that I'd like to share with you is engagement. Within the work that I do day in and day out, some years ago, the mystery of regulations, what it means to be licensed, how to file complaints, all of that was such a mystery to the public. So what we developed was a public-private partnership. We work with the local units of government, local entities, and the state and advocates. And we put together what we called resolve forums and consumer town halls. So we descended throughout the state of Wisconsin. We scheduled them during lunchtime, during dinner time, during breakfast times. We had meals and pastries and everything for folks. And we had the community come together and we demystify the process. So here's what the regulations are. Here's how you get started. If there's an issue or concern, if you're choosing a location, we really took all of that information, pulled it all together and presented information. So we had individuals that currently lived in the settings or services that we regulated. We also had people who were considering services. We had the providers, funders. We had a variety of different people, and it was very impactful. We did that for several years and really enjoyed the opportunity to engage with our citizens. We had a lot of good feedback. So one of the best practices, again, was engagement with the public, engagement with the providers, engagement with the entire industry, and looking to help the industry move ahead. One of the other things I'd like to share is, why did I choose this profession? I come from a family of caregivers. My mother was a nurse, and she had worked for many years in hospitals, long-term care, a variety of different settings. And that heart of a caregiver was implanted in me from a very young age. So looking at what my mother did, it was a calling. I had to do this. There was really nothing else for me to do. This calling to be in the healthcare field, the human services field, was a tremendous calling. And if you remember the story about the starfish, and as the man was walking on the sandy beach and he saw a starfish, and he would pick it up and throw it back into the ocean. And he would see another starfish and he'd pick it up and throw it back in the ocean. And someone asked him, "Why are you doing that? There's so many starfish." And he spoke back to the aspect that it matters to that one starfish. And when I think of why I do what I do, it's because it matters to that individual, to that family. I was in those shoes. I watched my mother care, and I wanted to be that source, like that man walking on that beach, finding that one person who needed something. How can I be of service? How can I help? How can I improve a person's life? So this profession has been a tremendous joy for myself. And then lastly, part of MIPA. MIPA, what a network of professionals. Over the decade that I've been part of our organization, I've had an opportunity to build professional working relationships with people all over the Midwest when I've needed best practices or resources, or sometimes I'm struggling with an issue, MIPA membership, the doctors, the nurses, the clinicians, you name it, would rally around. And while they would do that for me, I would do the exact same thing. And as a result, we made a difference. We are making a difference.